Children's Healthcare of Atlanta is one of the largest healthcare systems for kids in the country. We have a number of different models and physician groups, but we all can align around the same thing. We can align around quality.
10 years ago, Children's Healthcare of Atlanta began a journey to eliminate infections at its 3 campuses.
I think back to a very formative time in our program around 2002 when our then COO, now CEO, Donna Highland, brought together a group of administrative and operational and physician leaders under the auspices of the First Quality Cabinet for Children's Healthcare of Atlanta. And they really set the tone.
The cabinet developed a strategic plan which identified infection control as a key component to improving the overall quality of care.
What we try to focus on is preventing hospital-acquired or hospital-associated bloodstream infections.
One of the ways to reduce bloodstream infections is for everyone to clean their hands. And so we started a campaign we called Foam Up. And it resonated with everyone. We had little buttons made, little signs made, so the Foam Up campaign resonated. So the use of a campaign has been very successful for us in promoting our quality message. The most recent campaign that we've adopted is called One is Not Zero, where one defect, one degree of variation, one error, one injured patient, etc., is not zero. And our goal is perfection.
If one patient is harmed under our watch, that's not zero. And whose one is that? And so I'm a mother of an only child, and so it would be my one, perhaps. And so absolutely every day it seems overwhelming, but if you strive for zero, then you're going to achieve something better than what you have right now.
Children's Healthcare of Atlanta was created in 1998 through the merger of 2 established pediatric hospitals, each with a strong history of protecting the youngest and most vulnerable patients.
Eggleston and Scottish Rite, who at the time were really quite competitive hospitals, decided to merge to benefit the children of Atlanta. Pediatric healthcare in Atlanta was seen by the boards of those 2 hospitals as a precious commodity that needed to be preserved for the kids of Atlanta.
Today, Children's Healthcare of Atlanta is a center of pediatric excellence, serving children and families throughout the Southeast. As its caseload grows, so does the challenge to standardize procedures, eliminate variants, and reduce errors. Orthopedics is one program that's received particular attention. Children's Healthcare of Atlanta performs more spine fusion surgeries than any other children's healthcare system in the country.
Dr. Frank, the medical director for quality, brought forward information that showed disparities as to how we were caring for kids on each campus who were undergoing spine fusion surgeries. And so we said this would be a great initiative, a way to bring the surgeons from both campuses together and start looking at optimal delivery of care and identifying best practice.
The development of the spine fusion pathway benefited patients like Lauren Gassel, whose scoliosis was so pronounced that she wore a body brace for most of her childhood.
We used a brace to control her progression, but once you get to a certain age, the amount of height that you lose with the fusion is less than what you gain by correcting the deformity. At that age, she also had her curve progress despite bracing. So for me, it was an easy decision to say, you are a surgical candidate.
He talked about the possibility of course, infection, that's always a possibility with any surgery. Of course, we're dealing with the spine, so there's also the risk of spinal injury.
With infection prevention, it's trying to find out what factors are increasing the incidence of infection, isolating them, and then trying to control them.
I was kind of afraid how it was going to be, but I knew it would turn out good.
Infection control is working system-wide in the operating rooms, in the hematology oncology unit, and in the pediatric intensive care unit.
Our bloodstream infection rate for 2010 was 1.8. In 2011, it was 0.7. We went over 190 days with no bloodstream infection, and that's the longest period of time we have gone without a bloodstream infection. Previous to that, it was, I believe, 181 days.
One of the big reasons why our improvement efforts around BSI has been so successful is because it is an absolute partnership between the quality department and our operational colleagues. I view quality improvement as a team sport.
We are committed to the child first. We're willing to look at our numbers, and if there's a blip on the screen there, we're willing to swallow our pride a little bit and look and see, is there something different that we can impact? And I think that's been a key part of our success in continuing to move down towards zero.
We've had a lot of successes at Children's over the last few years, but you can always do better. One thing that's pervasive in our culture, for better or worse, is that we never feel like we're doing quite good enough, and so we're always striving to be better. And while that may cause some anxiety among the leaders and everybody else, I think it's healthy anxiety that pushes us to say that, gosh, 1 is really not 0, that we can move this dial.